Early palliative care, different for people with different conditions. This short video explains the rationale for early palliative care. There are 3 different typical patterns or trajectories of physical decline that most people have at the end of life. Early palliative care improves life's quality and in some cases may even prolong life. It offers an alternative to treatments by promoting realistic medicine. Patients, whānau and clinicians can all benefit from considering early palliative care, fully integrated with ongoing care to meet the likely needs of people with advanced illnesses. So what does early palliative care look like for people with different illness trajectories? There are 3 main patterns of physical decline as people's health deteriorates in the last phase of life. A relatively rapid decline, typically with cancer, an intermittent decline, typically organ failure, and a gradual decline, typically with frailty or dementia. Dying, like living, is a multidimensional experience. These consist of the physical, taha tinana, psychological, taha hininaro, social, taha whānau, and spiritual, taha wairua domains. So let's consider these 4 dimensions for people on each of these 3 trajectories. Let's consider the rapid trajectory first, typically seen in cancer. Physical decline may occur quite quickly after a relatively stable period. The social dimension tracks the person's physical decline. However, psychological distress and anxiety or worry tend to be worse at 4 particular times: around diagnosis, after treatment ends, at recurrence, and around death. Similar times to when existential issues may be expected. The message for people on the rapid trajectory is that they can benefit from aspects of early palliative care even when they may still be physically well. Other dimensions such as anxiety can cause major distress early on, so addressing psychological, spiritual, and family stress from the first presentation is really helpful. In the intermittent trajectory of organ failure and multimorbidity, the physical trajectory has these episodic dips, usually followed by partial recovery. Sudden death may occur during one of these episodes of deterioration or in between them. In the social domain, contacts often reduce, leading to decline socially. Psychological distress may increase, and often this occurs at the same point. Spiritual distress is harder to predict. These may be moderated by good relationships and support. The message for people on the intermittent trajectory is that early palliative interventions that address and reduce psychological or family problems may be more effective than just focusing on the physical health and treatment plan. And similarly, when managing the acute episodes, we should consider all the dimensions of need. Finally, the gradually declining health trajectory, typically found in people with frailty or dementia. A gradual decline in physical health may happen over months or years. For people with dementia, this is accompanied by increasingly impaired cognitive function. Looking at the social dimension, the psychological decline, and even existential distress, these often dip considerably before the end of life. Depression, family and social isolation or loss of meaning may predate the final physical illness. The message here is to support people in these other dimensions, not just the physical one, and promote resilience by enabling people to do as much as they can and by discussing and addressing common anxieties and fears. So the plan to help everyone live as well as possible until the end of life by offering early palliative care is: identify people early, if appropriate from diagnosis, and introduce early integrated palliative care. Consider people's different dimensions of need at present and discuss what matters most to them. Discuss what often happens in the different illness journeys with patients and their carers, so they know when they might need more help and support to cope in their own ways. While acknowledging the uncertainty, make an individual care plan with patients and families. Document, communicate, and review this regularly with everyone who needs to know. Identify early, assess all dimensions, and plan for all predictable eventualities. Remember, identify, assess, talk and plan, and communicate with all involved.